What are eating disorders? They are a serious mental health condition involving unhealthy eating behaviors. Most eating disorders involve an excessive focus on weight, body shape, food. These behaviors can cause numerous health issues such as low blood pressure, slow or irregular heart rates, feeling tired, weak, dizzy, or faint, constipation and bloating, irregular period in girls, weak bones, delayed puberty, and slow growth. As a result, overall health and well-being can be seriously affected. So, why does this matter in HPE? Stage 4 to 5 PDHPE often treats eating disorders as an individual health issue. Little focus is given to social, cultural, or structural influences. Teaching often lacks depth in media literacy and critical reflection. As we can also see, there is a rapid increase of eating disorders amongst youths. Media is also negatively impacting youth's body image and mental health by promoting unrealistic beauty standards. Perspectives we will explore will be ethical, historical, sociological, and cultural. In an educational setting, ethics means ensuring that the teaching is fair, respectful, and prioritises student safety as well as well-being. The New South Wales Department of Education states that teachers have an ethical duty to protect students' mental health and well-being. Sensitive topics such as eating disorders require ethical consideration in curriculum design and delivery. New South Wales Education Standards Authority shows how the PDHPE syllabus has limited focus on mental health and eating disorders, with a larger focus on physical activity, fitness outcomes, and risk reduction strategies. This absence of explicit ethical guidelines for addressing eating disorders in the curriculum leaves teachers unprepared. A few ethical dilemmas in eating disorders in health education is BMI testing and body measurements, appearance-based fitness tasks, e.g. before and after photos and weight-focused goals, overemphasis on weight and diet in health content, so obesity prevention focus, teachers using triggering or shaming language, such as burning off calories, limited teacher training in body image, mental health, and trauma-informed practice. Some more inclusive and ethical practices that could be implemented are they focus on functional fitness, skills development, and individual goal setting unrelated to the body size. Promoting personal progress and enjoyment of movement, celebrating diverse body abilities and differences in strength. Use of weight neutral language, shifting focus to overall well-being, balance, and mindful eating. Use supportive, inclusive language. Try focusing on how the movement feels, not your appearance or energy expenditure. Advocate for professional development in trauma-informed HPE and mental health literacy. We'll now look at the issues within the PDH curriculum through a sociological perspective. According to Sunny Ganizo, the basic insight of sociology is that human beings' behavior is shaped by groups to which people belong and by the social interaction that takes place within those groups. The current PDHPE curriculum often frames eating disorders through an individualized or behavioral lens, neglecting broader social influences, according to Hartley. These structural and systematic issues are often underrepresented or oversimplified in the syllabus content. Rather than viewing eating disorders as purely individual or medical problems, sociological encourages us to look at the bigger picture. Some examples of this would be media, which promotes unrealistic body standards and gender norms, encourage different pressures on boys and girls. This perspective is embedded in the PDHPE outcomes, particularly those focusing on identity, contextual influences, and critical health decision making. It enables teachers to go beyond symptoms and encourage students to question the social structures and values that impact their self-image and their behavior. Teaching from a sociological lens adds value by encouraging critical thinking about the role of media, culture, and gender. Promoting inclusivity, acknowledging that eating disorders affect diverse populations. Addressing systematic contributors like fat phobia, diet culture, and narrow beauty ideals. Empowering students to become active participants in challenging harmful social norms. McAdams, F. Soroff, McCoy, Ford, and Timko address how this raises important questions, such as how do we define health and beauty, who actually benefits from the current societal standards, and what responsibilities do schools and educators have in challenging these messages. So, why is teaching about eating disorders through a sociological lens important? It reveals root causes. It goes beyond the syllabus individual focus to highlight social pressures like media, beauty ideals, and gender norms. It builds media literacy. It addresses a missing element in the syllabus, teaching students to critically evaluate body messages within the media. It challenges harmful norms. It counters the syllabus outdated weight diet focus on encouraging critique of idolized thinness and diet culture. It also promotes inclusion, fills the syllabus's gaps by recognizing that eating disorders impact all genders, all cultures, and all body types, not just the one profile. A historical perspective involves examining how an issue or topic has changed over time and how past beliefs, practices, and social norms continue to shape the present. So, what's the problem within the stage 4 to 5 PDHPE curriculum? Has an outdated focus on weight, BMI, and diet based approaches, limited exploration of societal pressures or diversity in body image or experiences. Teaching materials often reinforce narrow stereotypes, thin, white, and female. It also doesn't reflect on how media and culture have evolved over time. Why is it time to rethink our approach? According to Headspace and Marks, students now face constant exposure to appearance ideals through social media. Education should equip them to critically analyze and resist harmful messages. Avoiding outdated methods reduces stigma and shame around body image. It encourages a more inclusive and empathetic learning environment. We now look at modern influences and modern solutions. Teaching must reflect on current issues such as social media, influencer culture, AI editing, and filters. Promote media literacy, body neutrality, and critical discussions. Use diverse case studies and inclusive dialogue to reflect student realities, as well as shifting the focus from fixing bodies to understanding social pressure. These are all things that work towards creating that gap in our curriculum. So if we work to proactively fix these, it will further help the education of our students. Now we look at the issues through a cultural perspective. Understanding culture and body image. Culture shapes how students see their bodies, food, and health behaviours. Western ideals, thinness, and control often dominate body image conversations. Aboriginal and other cultural worldviews promote holistic relational well-being. The New South Wales PDHPE syllabus gives limited attention to diverse cultural perspectives on body image. So what's the problem with this? According to Australian Indigenous Health InfoNet, the syllabus lacks specific content that reflects culturally diverse views of health and the body. Eating disorders are often framed through a Western medical lens, ignoring cultural differences. Aboriginal well-being models like connection to country and community are underrepresented. Teaching materials often fail to challenge white, thin Western beauty norms. Cultural stigma around food and body image in some communities is rarely acknowledged. Why is it time to rethink our approach? According to the New South Wales Department of Education and the Butterfly Foundation, stages 4 to 5 learners are at an age of identity formation where culture is a key influence. Without culturally inclusive teaching, students may feel excluded or misunderstood. The syllabus should encourage critical reflection on how different cultures define beauty, health, and worth. Culturally relevant education helps teachers support diverse students' needs and their voices. We will now look at the modern influences and cultural realities. Global media promotes Western ideals, but students view them through cultural lenses. The syllabus lacks support for navigating mixed cultural messages. Teachers need tools to navigate cultural stigma and encourage open conversations. Sharing cultural experiences builds belonging and understanding. Overall, the syllabus overlooks social, cultural, and media-driven causes of eating disorders, focusing too much on individual behavior. The content often reflects narrow Western ideals with limited inclusion of diverse or Indigenous perspectives. Ethical concerns arise when outdated or non inclusive teaching reinforces stereotypes or harms students' well being.